Welcome to the Pegasus Learning Platform. Pegasus is your home for clinical simulation and learning resources. This QT is for short study breaks and covers drawing and mixing insulins. Gather your supplies, including the insulin, alcohol pads if appropriate for that patient, a Band-Aid, and an insulin syringe. Make sure you use a syringe clearly marked for use with insulin, and check the size to ensure you have a syringe that will accommodate the amount of insulin you need to administer. Now that you've chosen the correct insulin as prescribed for your patient, roll each bottle carefully back and forth between your palms until thoroughly mixed, turning the bottle on its side. If the insulin is unopened, you will need to remove the cap, and you will always need to carefully wipe the top of each bottle with an alcohol pad. You will need to put air into the bottle to replace the insulin you plan to withdraw from the bottle. For example, if you're drawing up 5 units of NPH, you will need to first put 5 units of air into the bottle of NPH to avoid causing a vacuum in the bottle of insulin. So we'll put air into the bottle of NPH insulin first. We will repeat the same process to drop the regular insulin, replacing the insulin we plan to drop with the same amount of air. So now we'll put air into the bottle of regular insulin. After injecting air into the bottle of regular insulin, keep the needle in the bottle, invert the bottle, and draw up the required units of regular insulin. After drawing up the required units of regular insulin, you can now draw up the required units of NPH. You may wonder why we must follow strict guidelines when drawing and mixing insulin. Well, NPH insulin is cloudy. It's cloudy because of protamine, a substance that delays the effects of insulin so it can last longer in the body. Regular insulin is clear and does not have protamine in it, and we must be careful not to contaminate it. An insulin pump is an alternative way to get insulin. It's a small device that holds 2 to 3 days worth of insulin. The person refills the pump as needed, inserts a small needle under the skin, and changes the tube approximately every 2 to 3 days. This can eliminate the need for multiple daily injections. The pump holds rapid-acting or regular insulin, not long-acting insulin. The pump delivers a precise amount of insulin and can make tracking trends in levels easier. Not all pumps track glucose levels, but many have the capability to do so. It is discreet. There are many options for use, such as on the arm, hip, thigh, or abdomen, and it is small enough to fit in the palm of the hand. And remember, please review the responsibilities for medication administration and insulin peak times. Review patient rights. Roll the bottles gently to mix thoroughly. Put air into the NPH insulin first, then in the regular, then drop the regular, then the NPH. Do not contaminate the regular insulin with the protamine in the NPH. The pump can offer an excellent long-term treatment option to administer insulin. More resources are available to you in your course, and for more information, please contact your instructor. Please note this is a brief overview only. This quick timeout is for short study breaks, and understanding how to mix insulin and administer medication involves more than this QT covers. Thank you for your attention to this resource hosted on the Pegasus Learning Platform.